Students of Al-Iraqiyya University College of Dentistry, welcome to this tutorial. We will talk about the dental chairs, how to use them, equipments, and how to safely protect yourself and your patient. Please be with us. The first model we will talk about is the Santim ST303. We have in the conservative department 23 chairs of this type. The first thing you need to know how to power up your device. First, go to the wall socket. If it is like this, that means it is closed. And if you push it down, that means it is opened. The second check you need to do is the master valve. The master valve is located below the chair. And if it is directed to this side, that means the dental unit is completely off and your air, water, and electricity is cut off. If you want to turn it on, please turn the lever to the left side. The second thing you need to check is the emergency stop button. Emergency stop button is used to stop the device in cases of emergencies. One push to this side, the dental chair will stop every motion and all these systems will shut down. If you want to return it to its normal position, go ahead and turn the button clockwise. That will release the emergency stop button and everything will go back to normal. Now we will talk about each section separately. The first section we will talk about is the headlight. The headlight consists of an arm and a lever here to turn the headlight 360 degrees like this, and the light itself can go up and down like this. We see most of the time students turn the light 360 degrees like this and try to direct the light like this. This is not correct. You have a label here. The label should not face the patient. The label should be back and the light should face up, not face down. When you position your light, you have to position it about 1.5 meters away from your patient head. So the focus area of the light will be correct and you will have space to move around your patient. To turn on the light, you will come to the master buttons here in the table and you will push the light button. Pushing the light button will activate the light and pushing it again will deactivate the light. This is all for the light. We will go here to this section. We have here the master buttons to control the chair itself. Everything in the chair is controlled from here. And we have the let us say the connections for the turbine, high speed, low speed drills, and the triple syringe. First, talking about the buttons, all the buttons are programmable. You can set the program of the, let us say, the water, the amount of water that is released into the cup. If I press it now, we can say it will turn on for 10 seconds. Now it's automatically shut off. I want it to run for 1 second only. I should press set, press the button here continuously for 1 second. 1. Leave it, then I press set again. Now if I press the water, it will run 1 second and turn off. So if you want to change the setting, please first press set, press the water, count for how many seconds you want it to turn on, leave it, and then to fix the setting, press it again. Now let us see, a change has been done to the time of water. The same thing is for this button. It will turn on the spit-on water to wash the spit-on. Okay? If you want to change the setting again, you should press the setting button until the light is on. Press the spit-on water for how many seconds, then press the setting again. It will save automatically how many seconds you want it to run. The third button here is the water heater. In winter time, the water can be very cold. So to increase your patient comfort, you can press the water heater button so the water that comes in is warm and it will not affect your patient, especially in cases of periodontitis and exposed roots. The patient will be very sensitive to cold water. Okay, here we have 4 control buttons, 2 of them to control the height of the chair. If you press this one, the chair will go up, and if you press the other one, the chair will go down. And the other 2 buttons will control the back seat, if you want it to go down or to go up. The last button we need to use is the reset button. If you press the reset button, the chair will automatically go down, bring the back seat up. During this operation, you need to check that the side unit is cleared off and the tray is cleared off, because this is an automatic motion. If the side unit is like this, I will make a demonstration to show you a damage that can be done to the chair if this button is not used correctly. Let us say I press the reset. You see, now it will hit, and this maybe breaks the leather of the chair or break one of the arms here. The other important button is the lock release button. This button is very important. We always see students trying to pull the table down or up like this. This is not correct because there is a brake. If you want to release the brake, simply press this button and the table is free to move like this. Okay? This will not damage the chair, but moving the chair like this without pressing the button will damage the chair. Okay, now we have the connection lines for the turbine handpiece and scalar triple syringe. First, we will go to triple syringe. For each patient, the triple syringe head must be sterilized. If you want to release it, there is a button here. You push it, it will release the triple syringe. And if you want to put another one, a new one, sterile one, you push the button again, gently push the triple syringe, and then pull it up. It will lock, okay? So the operation is like this and like this. It turns 360 degrees and it gives air and water. This is water. The left one is always water and the right one is always air. This is an international code and it will not change in all types of chairs. The left one is water, the other one is air. Okay. We will go here to the slow speed handpiece. It consists of 2 units and it is detachable. You can see here, this one is the contra angle and this one is the air motor. The contra angle must be oiled after each use and it must go into autoclave. This is a must. The other one is the air motor. The air motor have ring here. The ring controls the motion direction and it controls the speed of direction. If you turn it like this, you will go toward forward rotation of the burr, and if you go like this, it will go into a reverse direction of the burr. Please always make sure that you are going into forward direction of the burr, as reverse direction will not cut the dentin and it will cause increased amount of heat generation. The other one is the high-speed turbine. The high-speed turbine have a push button design. You can push the button and insert the burr, then release it. This will lock the burr inside, and if you want to remove your turbine, you have to push the button and remove the burr from it. The most important point to check is to check whether your slow speed or high speed drill have this rubber ring or rubber sealing. If you don't have it, your device will not work properly and you will lose air pressure. So you have to check first that you have this rubber ring, and when you try to insert it, please pay attention that there is a big hole and a small hole. Your big tube and small tube should sit in the correct position like this. Then you push the locking screw and try to tighten it like this. Once it is tightened, now you have the ability to use it correctly. If you take a look here, in most of the devices, there is a marking. A marking says number 1, number 2, number 3, and scalar. These markings correspond to the valves to control these water lines or air lines. Now you see here these valves to control the water and the chip air. You can see here number 1, number 2, and number 3. This one will control the amount of water that goes into the tube number 1. Okay? And this one will control for number 2, and this one will control for number 3. So if you turn on your turbine and you are pushing the foot switch correctly, let us see here. This is the foot switch. Okay? The foot switch consists of an air control and a water control lever. If you are pushing the water control lever like this, and you are not having water, that means either the water control unit or valve is closed. Now I did close it. You can see there is no water. And you can notice that the turbine is not turning on because I'm not pushing the air. Now if I push the air, it will turn on, okay? I'm just pushing the water. The water is not coming in. Now if I open the valve a little bit, you can see water comes in, okay? So this is how to control the water in your pipelines. Now if you want to control the amount of air and amount of pressure that goes into the turbine or handpiece, you will control it from these valves. You can see in every chair there is here a control box of 3 valves, air valves. These control air valves gives the amount of pressure that goes in. If you push the air button and your turbine is not turning on while your triple syringe have air, that means you have closed this valves and you need to open it, okay? Please make sure when you open it, do not open it forcefully. Opening these valves forcefully will damage the control unit and it will cause all the unit non-functional. The last one I want to show is the scaler. The scaler, we have 2 types of scalers. One of them is the DTE and the other one is woodpecker. Woodpecker have this type of connection or adapter, and the handpiece itself is like this. If you take a look here, you can see a dot, and usually there is a dot here, or you can identify how to put it in from this smiley face that is drawn here. You can see. So it should be aligned one over the other and pushed gently in place. Do not push forcefully. Pushing forcefully will make these pins non-functional, and this is not repairable. The device will break and we will lose the device. So putting the handpiece like this, and if you want to change the tip should be changed using the key. The key is sterilizable in autoclave, and the tips are sterilizable in autoclave. Now if you want to open it, you will turn counterclockwise like this, okay? It is opened, and if you want to put it in, you should put the internal thread on the external thread like this and lightly rotate until it is locked. When it is locked, just give it a simple tightening of about 10 newtons, and that's it. Your device is ready to work. We do not want to see the students trying to tighten the scaler like this, or trying to put the scaler forcefully like this. This is not correct, and this will break your device. Now, the last thing we want to show is how to operate the light cure and the other functionalities. For this model, we have an attached light cure unit. It has a power button and the mode selection button. The power button is used to turn on the light and close it. and the mode selection button is either continuous or gradual increase or pulsating mode. The suction unit can be operated by pulling down the lever like this. It will automatically operate, or by closing it like this. The high volume suction unit uses the same method. If you close it, you take it up like this, and if you want to open it, you take it down like this. And the triple syringe for the assistant have the same type of head. You can pull it and remove. This is sterilizable, and you can put it back like this. Okay, so this is all for SAN-Team. We will go now and talk about how to change the water bottle. This is for service part. Before you start your operation, you have to check the amount of water. This is sterile water in your unit. It should be full up to here. If it is not full, you can switch off the air pressure. Now you can see the bottle is depressurized. Now once it is depressurized, you can rotate the bottle like this to remove it. This is a counterclockwise rotation. The bottle will go out. You go to the sterile room, you will find distilled water and sterilized water. It is a specific water. Do not use tap water. This is surgical water. You fill it up and then you return it into its place, and turning clockwise will tighten the bottle. Once it's tightened like this, make sure that your air is on and you are using bottled water, not tap water. This sign is for tap water. This sign is for bottled water. Always make sure you are using bottled water and the air is on. The other thing we want to show here is the X-ray viewer. The X-ray viewer have a controllable degree. You can loosen it from behind like this. You have these two screws. If you loosen it, it will move, okay? And if you turn it, it will tighten again. Use the switch here to open it or close it as you like. The last thing we want to show is the air pressure gauge and the control unit for the scaler. The air pressure gauge, if you press the air switch here, you will see that the air pressure goes around 0.2, and this is the correct between 0.2 and 0.3. If your air pressure is not like this, you need to adjust the air pressure valves like this. Please come closer. You can see this air pressure is not acceptable. I will increase it until it goes to 0.2. Okay, we did this adjustment from these valves. Okay, these valves are the responsible ones. You can hear the sound now. It is closed, it is fully open, and it is normal now. Okay, for the scaler, if you want to increase the power of the scaler, you will use this knob. If you rotate it clockwise, it will give higher power. If you rotate it counterclockwise, it will give lower power. And the water control is always beside this knob. In each type of chair, you will find the same thing. Thank you for watching this part. We will go to other models. Now we will talk about another model. This model is really close to the SAN-Team model. The only differences are in the buttons here. The buttons here have less functionalities because some of the functionalities in the headlight, but the basics are the same. This is for the water, this is for the spit on, and this one is for the water heater. And the set button is the same essentially. And we have the up, down, right and left, and the program. The difference here, the light button came here. You can see a button here to operate the light and to close it. And the other thing is this handle is detachable. You can remove it like this to sterilize it, and you can put it back like this. Okay, The other different thing is the valves here. Let us take a look at the valves here. The valves here is a little bit different. It is a master valve and the chip air valve and increase and decrease valve for the scalar and the scalar button. So all the three lines here are controlled from one valve only. And the other thing here is the same, which is the air control valves are essentially the same. The other thing we want to show here is the control for the bottle. You can see the bottle is the same. You can open it and close it in the same manner, but here the buttons are placed in a different way. The functionality is the same. If you put it up, that means it's for tap water. You can read it here, tap water and water tank. This is for water tank, and this is for the air pressure inside the bottle. So to give correct operation, this should be down and up, and this should not essentially goes down. You have to read what is the direction and what does it say. For example, if this is the water tank, you put it up, and if it is down, you put it down. Okay? This is for all for this model. We will go and talk about another model. Okay, this is another model. We use it in surgery department. The basic controls are the same. Here we can see the buttons are placed in a different way. This is for the water, and this is for the spit on, and the other one is the heater. And here we have the basic controls for the back rest and up and down, and the same set button to control these two buttons. The light here is a little bit different. The switch is a lever type switch. If you take it to the left, it will give full power. If you take it to the right, it will give low power, and the center is for off. If you want to turn on the chair, you have to put the switch here toward up. You can see now the chair is operational, and you can choose whatever type of light you need. For the service type and for the water here, you can see the water bottle is essentially the same. It is the same thing. You have to check whether it is full or not. And to start the service, as we have mentioned earlier, you have to take off the air switch and then change to the pure water again once you are done. Please try to read the captions here and direct your switch toward it correctly. Thank you, and let us go to another time. Now we will talk about another model found in periodontal and in pedodontics department. This model is a little bit different from the others, but all the functionalities are the same. You can see here the place of buttons is different, but the buttons are the same for the water heater, for the spit on, and for the water cup. The set button and the control for up, down, and backrest, and the programming. The headlight is the same. You can see the button for switching on, off, and the place for turning on and off the light wirelessly. Here you can see there is some control here, control valves, the master control valve and the control valve for the low speed. And here we have the water control valve for the scalar, and the power control knob for the scalar. You can see also here the pressure gauge is the same. Everything typically is the same. For the service of the chair, you can take a look here. We have a water bottle. The water bottle essentially is opened and closed in the same manner we mentioned earlier. This you have to take attention here that the tap water and the water tank position is different. You have to make notice which type of water you are using, and the control for air pressure inside the bottle is the same. Thank you. Finally, I want to thank you for watching this demonstration. The first thing and the last thing you should know, you have to operate your device safely. Keep your safety and keep your patient safety. Thank you.